introduce and invite Professor Rajesh Sinha. He's a corneal and cataract and refractive surgeon from RP Center, New Delhi, AIMS. Refractive surgery is a component where we touch the youth, teenagers' eyes, so they are the really virgin eyes, and we have got a very, very less margin of error. Now, outperforming a beautiful refractive surgery, but optimizing the visual outcome is a great aspect which has to be dealt, and all over to Professor Rajesh Sinha.
Thank you very much, and thanks Intas for having me here. I'll be talking about, as you very rightly pointed out, that you do a refractive procedure and you expect a 6/6 vision, and apart from that, patient should also feel the crispness of vision. So all that you want, and what actually happens that after any corneal based refractive procedure, dry eye is something that invariably happens to large majority of patients. Some may be symptomatic, some may not be symptomatic, because mostly we prescribe these lubricants in the immediate post-op period. So it is definitely a significant issue, and because when we do LASIK or any refractive cornea-based refractive procedure, we cut the nerves, and that is why, because the nerves are cut, the stimulus is deprived, this neuronal loop is broken, it is cut here, and so the stimulus doesn't go to the brain, and this secretomotor nerve impulses to the lacrimal gland does not go, and I mean it is reduced, and that's why you have chances of dry eye. It is more often seen with people who are contact lens wearers, long-standing contact lens wearers. More with a narrow hinge flap means you are cutting more, and of course with the surface ablation it is lesser. When femto LASIK started, there was a hype created that probably it will not have dry eye, but no, there are studies that have shown that there is no significant difference as far as the femto LASIK or a microkeratome LASIK is concerned. As far as surface ablation is concerned, yes, it is less. Why? Because you have to understand the neuronal branches, the neuronal plexus that is present. There's one subbasal plexus, one is subbauman plexus, and then you have stromal plexuses of nerves. Now, when you do a surface ablation, you do damage the subbauman and the subbasal plexus, but the stromal plexus is preserved to a large extent. When you do LASIK, you cut the nerves, you cut the subbauman, subbasal plexus, and then you ablate, and then you damage the stromal plexus. And when you do a smile, then what you do is that you remove a lenticule. So you preserve a large majority of subbauman and subbasal plexus, but you remove the stromal plexus. And that is why dryness is most often seen with LASIK and less with PRK and less with smile in the early phase. Gradually the nerves regenerate, and then things become better. Maybe at 6 months' time it becomes comparable. But this is what is the graph that has shown the recovery of the corneal sensitivity. So this is, the blue one is for the surface ablation, that is PRK, the green one is for smile, and the red one is for LASIK. Suddenly it dips down the corneal sensitivity, and then gradually it improves with LASIK. But with smile it dips down less, and then it improves, and with PRK it is the best. And this was a survey that was conducted amongst the dissatisfied patients after LASIK, and they found out that 1 out of 5 were dissatisfied because of dry eye. And of course, sometimes we prescribe drugs with lubricants, and that causes toxicity. So what is the management? What we do? We prescribe lubricants in all the cases of post-refractive surgery, whether it's a PRK or a LASIK or a smile. So artificial teardrops is the mainstay, of course, and we have to prescribe it at least for more than 6 months, sometimes a year or so. And preservative-free lubricating drops are preferred ones. Now, what is an ideal polymer? An ideal polymer is the one which should have a good wettability, optimal viscosity, osmotic protection, good electrolyte, etc. CMC is something which has been used for the longest period of time, and it has a good mucoadhesive property, and that is why it is many times accepted. But hyaluronic acid of late has come up with very good results and has shown great promise, and that is why many people have started preferring hyaluronic acid. And polyethylene glycol with propylene glycol and HP-guar combination also is a drug which is an option. But then a large majority, there was a question that whether you prescribe cyclosporin in all your post-refractive patients. Well, the answer is no. But there is a certain segment of patients who do have surface inflammation, so you can start, or they have preoperative mild dry eye, or they show subtle signs of inflammation, or they don't improve with the lubricants prescribed for a couple of weeks. In all these patients, you have to prescribe topical cyclosporin in order to improve the surface, because it is an FDA approved drug and it reduces the inflammatory mediators and reduces the surface inflammation. So these are some of the studies which have shown that cyclosporin does help. This is one study by Kanalopoulos group, and they have shown that topical cyclosporin treatment is an effective alternative in management of LASIK for myopia related transient dry eye. And this is another study that has concluded that topical cyclosporin A is an effective therapy for refractive surgery patients and dry eye that has worsened. Many times, when you give lubricant, the patient still is symptomatic, and then you have to give cyclosporin. This is another study which has shown that it is an effective treatment for reducing the time needed for visual recovery after LASIK. Why? Some of the patients of LASIK will read 6/6. I'll just take 1 minute more. Will read 6/6, but they will have that subjective feeling of blurriness. So all these factors are there, and that is what has been shown in studies, that when somebody who has been using cyclosporin, they have this feeling much better, and they have faster recovery of vision. This is another study which has shown that the role of cyclosporin is there to improve the recovery of visual acuity post LASIK. Another study in this direction, and this is another study which has shown that cyclosporin is an effective treatment for reducing time needed for visual recovery, and another study which has shown that cyclosporin has shown to be it improves corneal sensitivity at 3 months after LASIK. So this means that if the sensitivity increases, then the tear secretion will improve, and that is how it will take care of dry eye. There are some formulations that are oil-based formulations present in the market, which are emulsions, and they have decreased bioavailability, and they do cause some degree of stinging as well. And these preservatives, they also cause stinging. So this is one product which is preservative free. This PF stands for preservative free, and this is an aqueous formulation which has been very nicely presented by Dr. Amit and Dr. Namrata. And this has a pH of 6.9 or 7, and that is why, because of the aqueous preparation and because of pH being same as tear film, then the irritation in the eye is not there, and it is specially packed in an Novelia bottle, so the contamination risk is also not there. So in conclusion, cyclosporin eye drops, they are actually therapeutic. They increase the goblet cell density, they have a therapeutic role in dry eye, and they are disease modifying drugs. But yes, it takes some time for the drug to act. It takes some duration, as was mentioned in the study as well, that you need to prescribe for a few weeks in order to get some effect. So in conclusion, dry eye, yes, there is a high risk after corneal refractive surgery. Controllable factor is you can reduce drug toxicity, treat the preoperative dry eye, give preservative-free lubricants, and of course reduce surface inflammation by cyclosporin, preferably preservative-free. And last but not the least, patient education and counseling is very important. Thank you very much.
Thank you, Rajesh.